Good afternoon. Please welcome the Penn Dental School of Medicine, class of 2024.
Good afternoon, everybody. Those of you who are on stage left who can't see me, this is what I look like. Just figured, you're not going to get a good picture of me from there. Take it now. Okay, done. So welcome, everybody. Thank you for wearing your masks. Thank you for socially distancing as best you can. Thank you for registering with your vaccination card. Thank you, and thank you, and thank you again for all you're doing to stay healthy and take care of yourselves and families. So my name is Mark Wolf. I'm the Morton Amsterdam Dean. I'm going to presume we met virtually a year ago. I am so happy that we can meet in person. Do you know this is the first time this class has sat together, ever? So I need to welcome friends and family. We don't have a lot of faculty here for spacing, but they're watching. Welcome. Staff, students. The class of 2024 are an incredible group of people that have just undergone so much in a single year, and it's hard to believe. We're gathering here today to celebrate the white coat ceremony for them, but they already have them on. We did that a year ago. So we'll talk a little bit about what the white coat means again. You remember I did that last year. It's not the same script, so pay attention. We're gathering here. That's remarkable. It's wonderful because, 3 months ago when we planned this, or almost 4 months ago when we started planning this, we thought we were going to have an absolutely wonderful party together with people wandering through our school and proudly showing everything off. Things haven't quite worked out that way. Some people are virtual because of concerns that we have for small children and unvaccinated in an auditorium in a setting like this. We could not, in our own conscience, allow them to be together. Even if we are all masking, we're just not comfortable with our social distancing. It's incredible holding an in-person event like this. I'm just really taken by that. This year, we underwent an incredible year, and due to the pandemic, we're doing things differently. And the sad things I have to say to you, and I have to say to our class of 24, is I don't think April we were coming out of this. Today, I don't have that same confidence where we're going to have some bumpy roads ahead. Not only for us here in the United States, but for the world, and we'll talk about this. We need to recognize that we're part of a global community, and that disease gets on an airplane and spreads in 10 hours from one part of the world to another. It's not like traveling on a ship that takes weeks or months to reach that destination. It means we have a totally different obligation. So much has happened in the past year. So, if you recall, we all thought we were in the worst of this in March and April, and it continued to get worse. And when we reached August, we were starting to feel a little bit better that maybe things will get better. Let me give you some information. I'm going to speak about this with respect to science, our need for public health, and our need for our students to be all healthcare professionals. I know there are a number of you out there right now, but we all need to speak of science and to take an active voice if we're going to make a change. 1 year ago today, 5 million Americans had been infected with COVID-19. 169,000 had died, and that was exploding our mind. We could not believe that many people had passed away. Worldwide, 25 million people in August had been infected. Buckle your seatbelts, folks. Today, 35 million Americans have suffered from this disease, many of them living with long COVID symptoms long after they've had the disease. In the U.S., that's an additional 30 million people over the course of 1 year have had to undergo this, with millions literally having to be hospitalized. Untold hospital costs and expenses, money that was taken out of every one of our pockets that could have gone for improving health, went to sustain our lives and the lives of the people around us. It's not without cost. 620,000 Americans, nearly 500,000 Americans, have perished in this 1 year since we speak. Worldwide, 220 million people have gotten this disease, and it's reported, and by the way, it's inaccurately reported, that 5 million have died from this. These numbers are mind-boggling, and they're not slowing down. Yesterday, 620 Americans died. I ask that we all spend a moment just thinking about the people that have been lost over the past year. So, what does this have to do with a white coat ceremony? And if I can turn to page 2, I can get to that. No, it's not your page 2, it's my page 2. I didn't finish writing this until 8 o'clock this morning. The editors got it off the editing shortly after that to take care of my typos. So why did they die? And did they have to actually die? Is there anything that we as a society, that we as a community, that you and I and our profession together could do differently that might change this outcome? We failed as individuals to be smart consumers of science. As part of the healthcare system, we have failed to be effective representatives of science. As professionals, we have failed to be skilled and trusted public health communicators of the science. I'm going to give you a brief discussion about the meaning of our oath and how it speaks to our obligations as a healthcare provider. So I told you last year that Penn Dental Medicine was a historic school, made possible in part through the donation of Thomas Evans, for which one of our buildings is named. Upon his death, he charged Penn Dental Medicine to become a school second to none. Penn Dental Medicine has become just that. You need to recognize that we opened on time. We delivered more health care in West Philadelphia for patients of dental need than anybody else. We opened dental care centers that provided care for the geriatric, that provide care for the disabled. We met the need. They met the need. You proved last year that by enduring an education designed around the pandemic, that we are an outstanding institution. The Evans Building opened in 1915. I told you that a year ago. It was the Spanish flu broke out in 1917, 1918. And Philadelphia was a mainstay of spreading the flu. They held the giant Bond rally right in the middle of the flu. And massive numbers of people, 20, 30,000 people died within months of it. What's interesting about it is the science was very poor then. The science was very poor then. The things we did not know about disease were very poor then. It's important to recognize that understanding how disease spreads, how infection spreads, was just being discovered at that period of time. Cloth masks were the best things that were being offered for medical professionals and the people that were picking up bodies from the street. The population was instructed not to spit on the street because everybody was convinced that spit was the vector for the communication of this particular disease. They were wrong. Spit would transmit it, but it was a cough, it was a handshake, it was sanitary conditions that would spread it. Remarkably, if you get the chance, and the Mutter Museum is open, read about their flu epidemic display that they have. The recommendation was cucumber sandwiches and a whiskey concoction as the treatment for it. The whiskey may have made them feel better, but it certainly didn't do anything to the disease or the communicability. The science didn't have it. There was unfounded science that dictated how things went, and the best thing that could be done is just live out the pandemic. You're here to become students of science, consumers of science, experts in public health. Last year, during the virtual white coat ceremony for you and your family, I told you that the white coat was special. If you remember, I told you that it was not only the white coat as a stylish wear after Labor Day, it was okay. It's much more than that. It does give you superpowers. I told you that this is a ritual, the white coat ceremony. It didn't exist in the early 90s. Schools started using it as we went through the 90s. First at Columbia Medical School was to adopt it, and it slowly was adopted through the majority of schools. Some schools hand out the white coat as if it were the secret handshake when you walk into school, here's your white coat. But it's actually not that. Not at all. You're becoming a professional in a healing art. There are obligations that we take on that requires us 24 hours a day, 365 days a year to be responsible, even when it's hard, even when it's painful. People know you're important because you're going to have a Penn doctorate attached to your name. Any doctorate, people know that you're important, but a Penn doctorate is special. I believe that the meaning behind the white coat is what we do, not what we wear. So let's talk about the oath that you're going to take in a moment. There's only 16 pages of this. We're up to page 3. You know, that's the benefit of being dean. You capture the moment. They can't get up. They're not going to walk out. I won't sign their diploma. Not really. I would sign it anyway. It's okay. Don't walk out. The oath says more to a patient than I follow infection control guidelines that Lister had intended. As a matter of fact, most patients don't associate the coat with infection control. They associate the white coat with intellect, with guidance. And as a matter of fact, dentists are the most trusted profession amongst the public. The most trusted profession. And that's important. It says to the public that you're smart and well-educated, and I can tell you that they're all smart and well-educated, no matter how hard they have to try and no matter how many times they had to do that wax up over again. And just drop that 1/10 of a millimeter in the distal over there, just a little bit. It'll be perfect in a few minutes. What am I talking about? They know. We know they're smart. They're here at Penn. They're going to do wonderful things. They're going to be well-educated in the ways of science. We're going to make them consumers of science. The oath obligates us to be translators of science for those that don't understand it as well. In this sense, science not simply being able to work in a laboratory, but to be able to listen to news and noise that's coming out around us and say, oh, by the way, the veracity of that piece of science is not actually true. You may hear it a lot, you may find it a lot, you may see it a lot. But by the way, it's not true, and no matter how many times you say it out loud, it's not going to become true. That's a consumer of science. That's an advocate. It's also when science comes out, you say, you know, I just don't believe this. It does not add up right. Let me look into that. It's looking to find the answer and make sure that the science we speak is actually the best available science at the moment. It mandates that we take a responsibility for society and provide equity in all respects for health, social justice, and the racial environment of our nation. Because a nation, a people cannot be healthy unless everybody in it is healthy. And I use the definition of health in a very broad fashion. It's safety, it's food, it's the ability to be educated. These are all critical portions of what will make us healthy. The oath requires us to work for food security. Too many children go to bed hungry. We have to work for education, because only through education can we all become good patrons of the science. Only through well-balanced diets can children sit in a classroom and be comfortable with being in the classroom and learning. The oath mandates that you will spend a lifetime learning and staying current. It means what I teach you today may be outdated tomorrow, but if I taught you how to learn and how to be inquisitive and how to be a good consumer, you will be up to date in the future. Your patients know because you wear the white coat, you will always use the best evidence to treat them. And that evidence will change. We've seen this with wear the mask, don't wear the mask, don't wear the mask, wear the mask. You can't get a better example than that. Situations are changing, science is changing, the information is changing. We must stay agile. The oath mandates that you always place your patient's best interest above your own personal interest, and that you practice with honesty and integrity in all respects related to providing care. It requires you become a national example in leadership. It requires that whether we're talking about the PTA or we're talking about the soccer team, you have to step up to leadership, because your education, who you are, makes you that important person. The oath mandates that you be compassionate in treatment for your patients and respect their dignity and privacy no matter who or where your patient is. Wearing the white coat means a lot. We're down to the last of the 16 pages. So the oath that you take today comes with some awesome expectations. Traditionally, your faculty put the white coat on you. Your faculty believe, in fact, expect you will fulfill the public expectations of who should be a professional, and have the privileges that are shared with professionals. Wearing the white coat means a whole lot more. Today, we will reaffirm our oath. It means you agree to fulfill the mandates of our profession. It represents everything we expect our Penn graduates to be, and the future that we expect because of them. Congratulations for making it through this first year. It was crazy. Moving on to the next step of your professional journey, it'll still be crazy. Support each other, support your community, be the consummate professional, and join the legacy of great Penn dental medicine leaders that have come before you. I only went 15 minutes over. No, not that bad, never mind. I now have the pleasure to introduce our speaker, Dr. Rick Rader. Dr. Rader is director of Morton J. Kemp Habilitation Center in Chattanooga, Tennessee. He's actually a Brooklyn boy. Where he serves as medical futurist, predicting the future medical problems of people with neurodevelopmental disabilities. He is cross-trained in internal medicine and medical anthropology, and has made major contributions to identifying and, even more important, resolving the barriers to care for individuals with intellectual and developmental disabilities. Through organizations like the American Academy of Developmental Medicine and Dentistry, which he was a founder, Special Olympics, National Council on and he serves on the National Council of Disability. He has helped develop health professions curricula, particularly the medical profession, as well as national policy on disabilities and care, is widely published on the topic. He is editor of Exceptional Parent magazine. He is helping families understand and raise awareness of intellectual and developmental disabilities and what it means to have a child with these conditions. As you students will come to know, Penn Dental Medicine is committed to broadening competency of oral health professions in the area of care for persons with disabilities. You will be a competent practitioner in managing persons with disabilities when you graduate. We are honored to have one of the giants in our field join us today at this wonderful event. Rick, please.
Well, thank you, Dean Wolf, for the invitation to come and join you. As a physician, I feel a little out of my league here. Welcome to the class of 2024, and welcome to the parents, families, friends, and faculty. We also welcome the spirits of Pierre Fouchard, the father of dentistry, and Green Vardaman Black, the father of modern American dentistry. We know they're here to guide these newbies in their quest to earn the privilege of one day being called doctor. I have both the privilege and responsibility of presiding over the Penn Dental White Coat ceremony. It's noteworthy that your class, the class of 2024, was deprived of your white coat ceremony last year. The culprit, of course, was the COVID-19 pandemic. While your white coats remained on hangers, thousands of retired physicians and nurses bought theirs out of the closet and volunteered to help with the burden of an overwhelmed healthcare system. I hope that will serve as a reminder, an incentive, and a legacy that as you become healthcare professionals, you will forever have a calling, a purpose, and a role to help, to care, and to heal. And while things continue to be in flux, you are here, and so are your white coats. So congratulations and welcome. So, let's see. Sorry, guys. So, as a physician, whenever I am presenting to an audience, I am obligated to provide a disclaimer, just so you know if there's any conflict of interest. So here's mine. I'm not a dentist. As a rural medical officer in Africa, I had to pull several teeth, and without any training, experience, or knowledge, it was harrowing. Just how sweaty my hands were was only known to me. Later that afternoon, I buried my underwear in the African bush. So I pulled some teeth, and in addition to that, I've also had a bad toothache. And I understood why Shakespeare, in Much Ado About Nothing, remarked, "There was never yet a philosopher that could endure the toothache patiently." Not that either qualifies me as a physician to help fit you in your first white coats. So perhaps I owe you an explanation of how I got here. My older brother, Phil, is a dentist. And way back in the 1970s, when he applied to dental school, you had to carve a piece of chalk to exact specifications as part of your entrance exam. I watched him practice for hours and was fascinated how it took shape. I thought that looked pretty interesting and thought that maybe I should go to dental school. So he hands me a piece of chalk, a spec sheet, and a dull wooden-handled knife and sends me on my way. A few days later, I hand him my finished product, and finished while he examined it. He brought it up to his eyes, put his fingers across one edge, and then flipped it back to me and said, go to medical school. And I did. So I became a physician because I couldn't carve chalk. But I have always admired dentistry and dentists. My career has led me into the specialty of intellectual and developmental disabilities, where I learned that the #1 unmet healthcare need of this marginalized and stigmatized population was oral and dental health. And I became an advocate for improving the oral health outcomes of individuals with intellectual disabilities. And from across the aisle, I collaborated with dentists from the special needs arena in advocating for training, competency, and access to optimal oral health for this undeserved and neglected patient population. Over 50 years ago, in a crowded lecture hall on the first day of organic chemistry, you could hear a pin drop. At least in those days, organic chemistry was known as the dream breaker, because that's where the pre-meds and pre-dent students were weeded out. And I heard that the professor instructed the class, look to your left and look to your right, because one of you won't be here next semester. And he was right. I was lucky, of course, I wasn't there that day because I had lacrosse practice and never heard the warning. So who knows what would have happened. So I want to borrow that scenario and tell you to look to your left and to look to your right, because one of you will never welcome patients with disabilities into your practice. One of you will never experience the purity and rewards of treating someone who may not be able to express their appreciation for your skills and empathy or even remember your name. But I don't have to say that, because thanks to your dean and the commitment of Penn Dental, you will have the opportunity to learn what true, unadulterated, no-nonsense caring for another human is all about. Dr. Wolf is a leader in special care dentistry, and you will have the opportunity, the privilege, and the challenge to see where you stand as a clinician, as a humanist, and a respected member of the dental community. And even if you only see a few of these exceptional patients in your practice, your skills, wisdom, perspective, and rewards will be elevated, fortified, and impacted beyond your imagination. To justify my being here and earn my keep, here's a pearl for you. When I was a medical student, and right before we were brought into the clinic for the first time, one of my classmates asked our supervising professor a very insightful question. What do we tell our patients when they ask if we've ever done this on a live patient before? The professor thought for a moment and said, tell them you've done a number of these procedures. After all, 0 is a number. While this response served to enlighten the mood, it also touched on something very important. Patients care about how much experience their clinicians have. Patients want their dentist to have done whatever they're doing a number of times. Nobody wants to be somebody's first crown, first filling, or first root canal. People trust experience, but they also want to know how much you care. Show them that, the first time, every time. In the 19th century, respect for the certainty of science was in stark contrast to the quackery and mysticism of 19th century medicine. To emphasize the transition to the more scientific approach to modern medicine, physicians sought to represent themselves as scientists, and they began to wear the most recognizable symbol of the scientist, the white laboratory coat. This led to the more recent association of the white coat with medicine and dentistry since its conceptual. The first white coat ceremony was held at the Columbia University College of Physicians and Surgeons in 1933. It has been typically performed in the third year of training, which demarcated the transition from basic sciences to clinical training. It is noteworthy and a reflection of the philosophy of Penn Dental that the white coat ceremony is held at the beginning of the first year. It demonstrates their belief that from the first day, the dental student is recognized by the faculty, the teachers, and the professors that you are entering the portal that will change your life forever. It is an acknowledgement that you have demonstrated you have the hoped-for skills, determination, commitment, and dedication to undergo several thousand hours of arduous labs, lectures, clinics, exams, and certainly at times self-doubt. The presentation of your white coat at the earliest point in your training is a declaration by the faculty that they will respect you, support you, and mentor you over the next 3 years as you prove yourself worthy of being called their colleague. It is also an announcement to the community that you are being groomed, earmarked, and identified as a candidate that will emerge as an ethical, competent, and compassionate doctor of dental medicine. Welcome to the profession and to the long line of graduates of the most respected dental school in the United States. Congratulations to you, your families, and to those patients. Many have not even been born yet, who are waiting for you to introduce yourself to them as their doctor. Your clinical coat has 3 pockets. I remember mine, bulging with a reflex hammer, an otoscope, and a stethoscope. That was before we realized how cool it looked to have the stethoscope hanging around your neck. We also had a pack of peanut butter crackers and dozens of index cards with handwritten notes on patient lab and pathology reports in case we got quizzed on rounds, and we did. You don't have to carry your instruments around. You will have electronic dental records to refer to. So what do I recommend you carry in those 3 pockets, in addition to the peanut butter crackers? I hope you will fill your pockets with 3 commitments, 3 core values, and 3 reflections. Put your patients in one. They are the reasons, hopefully, why you are here in the first place. Their best interests should always dictate your treatment, your compassion, your behavior, your decisions, your ethics, and your appreciation of the respect that society will provide you. Put your profession in the second one. Dentistry has evolved into a vital and irreplaceable part of health and wellness. Put your allegiance, support, and appreciation and gratitude for your teachers in that pocket. They are the keys to the kingdom. They are the linchpin between your caring and earning the right and privilege to wear a white coat and just having one. Your keeping true to the profession's code of ethics after you leave here is the only reward they seek. And in the last pocket, place yourself. Hopefully, there is room in it for you to build your self-confidence, your self-esteem, your self-respect, and your self-satisfaction that you made the right choice in becoming a doctor. That you will have the health, stamina, drive, and unfaltering commitment to becoming the best dentist you are capable of becoming. I have a gift for you, and it doesn't need a separate pocket, but it does need a place in your life. It's a small enough card to carry in your wallet, purse, or backpack. It should easily fit into a desk drawer, or taped to a bathroom mirror, or copied onto your phone. My gift to you is a card, this card, and it's made to fit in any of the 3 pockets on your white coat. On one side is a photo of someone you need to place in a prominent part of your hippocampus. That's the pocket in your brain where memories are stored. It's a photo of DeMonte Driver, a 12-year-old boy from Maryland who developed a toothache that went untreated. They were unable to find a dentist who would treat DeMonte. His mother repeatedly heard that the amount that Medicaid would pay the dentist would not cover their expenses, and DeMonte's abscess migrated to his brain and killed him. What really killed him was neglect, indifference, and abandonment. So I want you to look at him and pledge that you will never turn your back on someone like DeMonte. On the other side is also a gift. Over the last few years, it has become popular for individuals to create what we call a bucket list. The name comes from the expression kicking the bucket, a symbol of dying. So the bucket list is a list of things you need to do before you die. My parting gift to you is a dental bucket list. Several years ago, I started to gift these to dental students nationwide, and without any request to hear from the students, I started to receive some back to me in the mail. They were from students who I didn't personally know. They were from students who received the card in white coat ceremonies or graduation speeches I had given. Some only had 1 box checked, others had several, and a few had every box checked, and they all had thanks handwritten on the bottom of the card. So keep it and use it as a scorecard. I hope it becomes yellow from age and the edges worn from you holding it and seeing more and more boxes being checked and having you quietly smiling with pride as to the dentist you have become, the dentist that your teachers, faculty, and Penn Dental alumni hope you will become. Let me just read some of the boxes that I hope you will check. As a new dentist, I am committed to treating at least 1 patient in my career who cannot see me, cannot hear me, cannot thank me, cannot understand me, cannot high-five me, cannot recall my name, cannot read, is at the end of their life, may not like me, is confused and scared, is someone I once stigmatized, someone I might be able to pay me, somebody who competes in Special Olympics, and perhaps somebody who has lost their memory. So congratulations to the class of 2024, and basically good luck with your white coat. Now, one of the things I wanted to share with you is that one of the hats I wear, as Dean Wolf said, is I'm the editor-in-chief of Exceptional Parent Magazine. This is a 50-year-old award-winning magazine that is basically the voice of the disability community. And basically, upon our 50th anniversary, we decided to pick out 50 great advocate leaders from the United States and abroad. And today, it gives me great pleasure to award the Exceptional Parent Magazine Code of Excellence and Recognition to your dean, Dean Wolf, as an advocate. Now, here's one of the most important takeaways. You guys have all had the opportunity to be clinicians, educators, researchers, but the thing that I think is most prominent about your capacity is to be an advocate. Be an advocate for your patients. Get to know who they are. Fight for them. Fight for their respect, their dignity, their inclusion, and their place in society. And so, Dean, if you'll come up here. Let me read this to you. Be it known to all that upon the recommendations of the Editorial Advisory Board, Exceptional Parent Magazine has selected Mark S. Wolf, DDS, PhD, as an honored advocate hero. In recognition of meritorious contributions to the disability community and for a commitment to ensuring the acceptance, inclusion, and celebration of individuals with intellectual and developmental disabilities. Thank you.
Thank you. Thank you. Most appreciated.
Call your mother.
You know, here, we've got another hour. Margaret just passed out in the back. Before we go any further with the agenda, which is actually the reading of the names of each of our class of 2024 and allowing them to come handshake with me, or elbow bump, I hope, because that handshake thing is disgusting. Pre-COVID, it was disgusting. Now it might be even worse. I'd like to mention another giant in the field of advocacy for persons with disability who's with us on this occasion. Dr. Steve Perlman, who happens to be an adjunct professor in our division of pediatric dentistry, is founder of the Special Smiles, an oral health initiative at Special Olympics. He's co-founder with Rick of AADMD. He is an advisor to the President's Committee for Persons with Intellectual Disabilities. For me, he's been an invaluable advisor on how to advance in this field of advocating for persons with disabilities. I hate admitting it, but he's a former professor, or he's still a professor, formerly worked at Boston University, but he is with us at this time, and I want to thank him for joining today and taking the time to both see our new facility and to help advocate for all persons with disabilities. Please, Steve, if you would stand for one moment. So it's now my pleasure to welcome somebody who all of you folks know, and you have seen him on Zoom at least last year, Dr. Yuri Hankowski, our Associate Dean for Student Affairs or Student Life. Dr. Hankowski oversees the Office of Student Affairs along with Margaret Yang, and you know, if you don't know him already, you'll quickly discover him as a faculty and staff member who has a heart that's massive in size and is incredibly engaged in student wellness and life. Dr. Hankowski and his team are tireless on behalf of all of our students, and again, it's my pleasure to, you know, he actually speaks with a great accent, so when he announces names, they always sound great. So we use Yuri as our announcer of names. Yuri, please. Thank you.
Thank you, Mark, and it's welcome all of you. Great to see you actually do exist in person. I met some of you in person, but I think it's a great occasion that we finally all together again after the first year. So what we're going to do now, I'm going to call your name in alphabetical order. You will be congratulated by the dean, and photograph will be taken, which will be then downloaded. Every year I ask to hold the applause till the end. I'm not always successful, but try your best. Okay, so the first person, Justina Ann. Nira Algazaz. Laura Anzola Castro. Nneka Atupulazi. Pearl Batalora. Kristen Belger. Alexandria Borelli. Aaron Bradley. Allison Quinn Bui. Yu Chi Tsao. Nicole Caponia. Jonathan Karakapa. Kathleen Kashidi. Emily Sarumele. Travis Sherman. Alexander Khmelinsky. Hannah Cho. Diana Chama. Gabriela Ciancimino. Skylar Clark. Alyssa Curry. Aubrey Dion. Kunal Desai. Prachi Desai. Thao Do. Samuel Dolan. Makwachi Ekwunife. Sarah El-Rahmani. Paul Espiritu. Carla Estrada. Alexandria Fava. Ariela Feitelberg. Kayla Francisco. Ria Godasra. Daria Goikman. Joanna Haddad. Isabel Hansen. Brett Harrell. Andrea Henao Fernandez. Matthew Hirschberger. Jonathan Huang. Shaheen J. Singh. Michelle James. Nicholas Johnston. Annabelle Kelso. Brett Kim. Christopher Kim. Kim Kyaol. Kim Minjung. Ian Kosowski. Amulia Kotha. Alexander Lam. Anthony Lambright. Jarrett Layton. Amanda Ledner. Wenyan Lei. Sarah Lee. Alice Lin. Jason Lin. Amy Liu. I Wen Lu. Sergey Loktu. Rebecca Luo. Tiffany Lynch. Molly McCormick. Meredith McEachern. Sydney Miller. Isabella Monticello. Saba Mozaffarian. Justin Muir. Pratyusha Mutiala. Stephanie Eng. Brian Nicholson. Nushin Nursalehi. Alexis Pagan. Domenica Paredes. Tiffany Park. Deep Patel. Monica Patel. Tural Patel. Maura Pezula. Jayue Chu. Rena Rod. Anwar Radwan. Akhil Ramani. Rafael Aranjo. Sophia Rappaport. Kevin Riley. Amanda Reisman. Thomas Roberts. Josephine Russ. Milana Russo. Anaita Sabet Payman. Michelangelo San Juan. Saryu Sangani. Zunish Sakib. Muhammad Shama. Benjamin Schelling. Jia Jiashi. She's not here, okay. Ani Stino. Nader Sidom. Joanna Smazinski. Alicia Song. Anna Song. Tony Song. Cassidy Steen. Madeleine Stein. Steven Stein. Melissa Stock. Julia Shurnicki. Joseph Tafunai. Chintan Thakur. Elena Trice. Nilam Vora. Aki Wan. Casey Warshawski. Nikki Way. Logan West. Ali Wilk. Emma Wilkinson. Elizabeth Wong. Hillary Wong. Kylie Wright. Zhujing Su. Bingjan Yang. Jonathan Young. Alexandria Yu. You are you. Ladies and gentlemen, ovation to the class of 2024. Thank you all. Now we're coming to an important part of our ceremony, and that is the professional pledge. I would like to invite our Associate Dean of Graduate Studies and Student Research, Dr. Esra Schenger, to the podium to lead the class of 2024 in the Penn Dental Medicine Professional Pledge. Thank you.
The class of 2024 will now recite the professional pledge found in your program. In the presence of you, their family, friends, and peers, they will publicly acknowledge the responsibilities of the profession and their willingness to assume the same. Well, I was going to ask the class to rise, but they did that already. Okay, please repeat each line after I have recited it. As I enter the dental medicine profession, I vow to keep this pledge and practice these stipulations.
As I enter the dental medicine profession, I vow to keep this pledge and practice these stipulations.
I understand that my primary responsibility is to my patients.
I understand that my primary responsibility is to my patients.
To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty, always placing the needs of my patients and community first above my own.
To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty, always placing the needs of my patients and community first above my own.
I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession.
I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession.
I will conduct myself with integrity, treat my colleagues with respect, and wherever possible, work to advance the oral health of society.
I will conduct myself with integrity, treat my colleagues with respect, and wherever possible, work to advance the oral health of society.
I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond.
I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond.
All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve.
All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve.
Congratulations. You may be seated.
Another 20, 25 minutes, we'll be fine. Yeah, it doesn't get any laugh anymore. I'm looking for the page that tells me what's next. Here it is. Thank you. This does conclude our ceremony. We have another ceremony inside this room for the class of 25. We're going to use some slightly different words if you want to come back in. No, we want you to not come back in. It's not that good to listen to a second time. We have very abbreviated refreshments outside for you to enjoy. I promise we will find another venue in the future for us to bring everybody together and actually do right and party appropriately. Pictures can be taken under the Annenberg Pavilion tent outside. I present you the class of 2024. I ask that you all safely just get out of here, go outside, leave, or thank you very much, everybody.